a nod when you want me to go.
All right, so I guess I'll kind of handle the introduction. My name is Andrew Peterson. I'm on the Innovation Advisory Team, and I'm going to kind of be here. I'll monitor kind of the tech support stuff and the chat, and I guess I'm kind of the facilitator. Um, and I'm really kind of here just to kind of mute my mic and shut off my video and hand the presentation over. So it's all yours.
All right, sounds good. Thank you, Andrew. And thank you to everybody who's come to see this presentation today. And really what we have is a panel discussion. And we got a number of people on the call who are going to be participating, including a number of students who I'll introduce, as well as Dean Steve Durst of the College of Pharmacy. And what we're going to be talking about today is just the fall reentry. I say fall. It started out as the fall reentry, testing program, and talk about how we use this opportunity to really provide a unique rotation experience for our pharmacy students. And starting out, if we think back about a year ago to when this pandemic was just getting a lot of attention and catching ground, after the spring semester, I remember sitting around and have people talking about, well, when things get back to normal at the end of the summer. And so I think a lot of people really were hopeful that this was, just going to be a short-term plan or problem. But it became readily apparent that it wasn't going away, and that we needed to start thinking about how to reopen campus safely and provide a safe educational environment for students, faculty, and staff. And what I'll ask you to do is, just keep an eye on this graph over here, because this is looking at the cases of SARS-CoV-2 per 100,000 of the population of Mecosta County over the past year. Well, so near the end of the summer, it was decided that in order to reopen campus safely, we need to have some mandatory testing on campus. And we started that looking at residents, all residents and staff. And when we decided to do this, we did it at the same time when everybody else was trying to do testing and figure out what to do. And so there were a lot of barriers to implementing good testing programs, not the least of which was shortage of tests. And even though we would have liked to use a rapid test at that point in time, we were forced down the path of using a more laboratory-focused PCR-based test. And there were, it was very accurate, but we had a delay in getting our results back. But we were able to do it, and essentially what we ran were specimen collection sites. People would come in, they'd collect a swab, and we'd send it off. And then they'd go along their way until we, got the results for them. We looked at where this testing program was going to be kind of managed, and it all came out of the, testing, SARS-CoV-2 testing committee, if that's what it's called. I'll let Dean Durst correct the naming of that. But it became evident, very quickly that Burkham was not going to be able to handle the workload, especially with asymptomatic testing, because Burkham's real function is to support management of individuals who have some sort of ongoing illness or symptomatic disease. They're more focused in being able to support, tens to 100 type of people a day, as opposed to thousands of people on any given day. And at the same time we were trying to figure out what to do, there were a lot of emergency declarations at the state and federal level that really allowed pharmacies or pharmacists to take a prominent role in testing efforts. They were allowed to order the test, run the test, result the test, service providers, and so forth. And one of the things that we had done years ago in the College of Pharmacy curriculum was also start talking about diagnostic tests. So we had already built into our curriculum specimen collection techniques, test performance assessment, and so forth. And so that all just kind of came together nicely. And because of those opportunities, the College of Pharmacy was asked to play a prominent role in the testing efforts. But we weren't the only people. And man, anybody that's been through any of the testing, we need to thank these two people on campus as well from an asymptomatic testing standpoint. I'd never met anybody from Auxiliary Enterprises that I was aware of, but knowing just what Jaretta Harris's group has brought, to this testing program, we could not have kept campus open without them. And Allie Molnar, who before the pandemic was over in racket and fitness, man, I would not know that she is not some sort of, logistical planner guru, because what she's able to do to help support the on-campus testing has just been amazing. So I'd like to give a shout out to those two. So very quickly after we started to do the PCR testing program, it was realized that this problem was not going away, and we were going to have to be doing testing on campus for much longer than we had anticipated. And because of the time and the costs that were associated with the PCR testing, we realized that it was not well suited for a long-term solution. In September, the campus testing committee found a reliable supply of a rapid antigen test, which provided results in 15 minutes and was available for use at 80% less expense on a per test basis. So that made that more attractive. And as we began to switch to the new platform, we realized that there were a lot of things that needed to be considered. This was not like just changing out the swabs and going to a new platform, but there's different procedures that need to be put in place, different considerations. We had no idea if anybody else, in the country were using antigen tests for asymptomatic testing. So we were, had to get a lot of information about best practices. We learned that the number of volunteers that it takes just to watch people stick a swab in a tube and send it off was a lot less than if we actually had to run the tests right there on site. Since we were using some of these emergency declarations to give us authority to run these tests, we had to continue to monitor the legislative landscape. And we were going from a PCR-based test, which is usually considered the gold standard, to a different system. And we had to understand a lot about the test performance. And these were a lot of questions that we had, going into this. And, it was identified at that point in time, wow, this is a great opportunity. Great opportunity, for the university, but a great opportunity for students to learn, what was going on, what goes on behind offering these type of programs. And, we outlined a number of educational opportunities that lined up nicely, providing a good educational experience, but also a lot of service opportunities and how, the students were going to be filling a critical need for the university at this point in time. And so really, we just sat down and thought, man, this is a once in a lifetime opportunity for us and for students. And, we decided to offer this program. And Dean Durst, please jump in at any time if you need to correct me or add anything. So we put a call out. In the first groups of students, we had students, looking for volunteers, and we were looking for student, to be recommended by their preceptors, because we knew that we were going to need highly motivated students to help us out in this. And what we originally outlined is we had a 6-week experience, and we thought, and again, I'm going to highlight thought, that this rotation would be predominantly supporting on-campus activities, helping us keep up with the medical literature related to COVID-19 and related to the legislative declarations. We had saw a need for continuing education on campus for COVID relating information, and we thought that the students could do that. And we are also going to have the students work with individuals who are collecting and analyzing on-campus data to help us to better direct our testing efforts. And up till this point in time, we've had 3 groups of students who have participated in the rotation. And these are the students, that have participated. We had, two of the students from group one are currently with us. I don't mean, the others have passed away, but I mean, they're currently with us here on the presentation. So we've got Dan, Nguyen, and Whitney Templeton, who are with us. From group two, I saw Casey Kapczynski join in. I'm not sure that Jalen was able to be with us. And then we have Taylor Jones and Indira. I'm sorry, Indira, I can't pronounce your last name, and you know that. You can fill me in. Are on their third group of students to go through this rotation.
Well, thanks, Dr. Klepser. That was a great, maybe I'll jump in here for a minute before we get into the next slide, if you don't mind.
Yeah.
Yeah, that was an excellent sort of 2 or 3 month synopsis. I wanted to kind of highlight some of the other activities that were happening right along with this. The testing task force that Dr. Klepser referred to was meeting at that time twice a week. And we were well aware of the testing expectations as well as the demands that would place. So we had started talking about a clerkship. We had talked broadly across the university about student volunteers. We knew it would be a significant effort that would both be dependent on students, but also provide students a great opportunity to really expand their understanding of public health and public health in a pandemic. From a pharmacy standpoint, there was a lot of discussion, a lot of email across the colleges about how they were involved. I was calling a couple of similar programs to ours, and they had engaged students, mostly students in the advanced clerkships, to provide a lot of the testing. As Dr. Klepser said, everyone was really scrambling with regard to what type of test they would use. Some of those that had decided early on that they would be doing testing were able to do point of care testing from the start as students entered in the fall. Others were switching from PCR to point of care. To be honest with you, I think others really were still planning by the time we had already switched to point of care testing. So we were doing very well. When we looked at student engagement, also as was pointed out, and I'm just underlining, we wanted the students there, we wanted them to be collaborators in the effort. And there's an important part of our curriculum that I think is seen more commonly, maybe under different terminology. We call it the co-curriculum. It's that part of the curriculum, part of the students' development that kind of lies alongside the curriculum. And it's developing those professional skills, experiences, how to work across professions, that sort of thing, that is so important to the co-curriculum. So this really fit in with that part of it. So we moved forward, and I'll stop there and let Dr. Klepser move on now with, as you can see here, how group one entered and what happened in group two and group three.
All right. Well, again, as we were, trying to, decide what to do with this rotation, we were talking about that during a time, maybe September, early October. And you can see what the disease burden in Mecosta County looked like. By the time group one hit, we were in a situation much different than what we had planned for. We are, skyrocketing cases. So what they were asked to do, maybe it was a little bit different than we thought. And then just as soon as we thought we had things all set up with that group, we had winter break, people went away, our cases started to drop. And then we had group two come on. And so really the needs for the student had to evolve, as the situation on campus evolved. And you can see that, for each of the groups, there was a slightly different focus, for each of them, as I mentioned. Whereas group one was much more involved with development of policies and procedures and standard operating procedures. We were really looking, from the testing standpoint, looking to identify infected individuals at that point in time, We wanted to know who had the disease so we could get them away from non-infected people to keep the outbreak from growing more rapidly. By the time group 2 came on board, really this group started early January, where all the conversation was, okay, all these people have gone back home. How do we let people come back onto campus safely without creating another outbreak on campus? And so this group focused mainly on testing asymptomatic individuals to identify non-infected individuals. We wanted to see, who we could, allow to continue their normal activities. At this point in time, we also started, gearing up for long-term testing, alternative testing sites at the College of Pharmacy, and whatnot. And at this point in time, we started seeing the vaccines roll out. And how did this group and how did testing play with the immunizations that were going on? And now finally with group 3, who's just not even a week into the rotation, they're still, looking at screening asymptomatic individuals. And again, looking for individuals who are negative to allow more in-person instruction. Also, because of the interactions we had with the Kent County Higher Education group on COVID, we were reached out to by Grand Rapids Community College to assist with offering screening to their athletes to support their program. And now I think as we're starting to see our numbers fall a little bit more, we have to start thinking about, okay, what does testing need to be in the future, or does it need to be in the future? And so we're struggling with different questions at this point in time. This rotation has not just been about, throw the students, into a group of patients with swabs in their hands. Hopefully, in addition to those outcomes, there's been some significant educational and scholarly outcomes. The first group of students, it was much more theoretical, at that point in time. How do we operationalize? What are the best practices? What are the best tests? So we spent a lot of time doing data collection. The second group of students, at this point in time, we started to have data and our testing technologies shifted. So we were working, there were the EUAs, emergency use authorizations for home testing kits. Wow, how do you use those? So we wrote a review paper on that with some other faculty. We analyzed some of our testing data from athletes to assess the performance of the test kits that we're using. And we partnered with people from public health and clinical lab sciences to write those. So we had some interprofessional collaboration. Group 3 students, they just came on board, and I think already they got thrown at them the fact that they're going to be helping look at the data. Right now, we're changing our testing platforms. We're going from this BD Veritor system to a new Abbott system. And we're doing that because maybe improved performance with the Abbott system. It's also 1/5 the cost of the Abbott system. And there's also some companion software that make it really attractive. But before we do a full scale switch, we need to look at the performance of the tests comparatively, and we need to look at operational logistics and whatnot as well. So right there, I'm going to stop sharing my screen. Dean Durst, do you have other comments at this point in time that you'd like to throw in?
Yeah, I would just throw in one other comment and then let the students start discussing. The other piece of this, and I think for faculty and staff that are here from the university, that in the strategic plan, there's a focus on experience-ships across the university, across all the programs. And certainly experience-ships, clerkships have been a part of the pharmacy curriculum. Roughly 1/3 of the curriculum is experiential from its very start. What's so unique about this is we took the pandemic, definitely an opportunity for experiential education, and then crafted a clerkship that would, in fact, bring to the students this ability to engage in the pandemic while at the same time working with that experience-ship model that the university supports. So it's one of those things like we see always, especially I think in education and especially at Ferris, where the situation arises, it's unique, it's kind of appealing, and we take advantage of it. We make it available to the students. We fit it into our curriculum. We use it to essentially move forward our educational mission. And that's exactly what we've done. Now it's still evolving. And as you'll hear from the students, it's had some successes. There are probably some refinements too that we need to make. But it seems so consistent with our approach here at the university to ensure those experiences enrich the education of our students.
Excellent. Well, thank you. And so what we're going to do now is we've invited the students that had served on the rotation, if they were able to come back on and join this presentation, and just wanted to have them reflect back on their experience. And we've got some questions that we can use to ask them to get the ball rolling. But if you guys have questions for the students and their experiences and everything else, please cut me off and take over and ask some questions. I think that would be really helpful. But to get the ball rolling, maybe what I'll do is I'll, again, post some of these questions, and I'll go ahead and I'll, pick on a student, and we'll run through you guys to give you responses. But the first thing, man, this rotation was established back at just the beginning of really the fall, when we really hadn't seen the surges and stuff like that. Why did you want to participate on a rotation like this? What were you hoping to get out of it? And I'm going to start with group 1, and then I'll go to group 2, and then I'll end with group 3, maybe in a logical order to see if, answers change. So Dan, I'm going to start with you.
So when deciding to be on this rotation for myself, I knew that this is a once in a lifetime opportunity, especially it's a pandemic, and I really wanted to have a contribution to make a difference into our community. And that's why I was interested in this rotation, to make an impact, direct impact to our community on this rotation. And that's what I did out of it.
Okay. Whitney, why did you want to be on this rotation? You can be truthful too.
Yeah, so I wanted to be on this rotation. My main reason, I've always been super interested in infectious disease. It's my main interest area. I'm in the process of applying to residency programs, and that's my goal for PGY2. So infectious disease has always been important to me. And when Dr. Klepser sent out that notice of the students they were looking for, I actually had a couple preceptors send me an email saying, hey, they're looking for a highly motivated student. It sounds like Dr. Klepser just described you. You should check this out. And then the Friday before the rotation started, I actually got COVID, and I wasn't able to go on to my next planned rotation. So it worked out well for me that I was able to step into this rotation, do virtual for the first week while I was isolated at home. But it was just really cool to experience it as someone who had COVID and kind of realize, even as interested in infectious disease as I am, I knew so little about COVID. So it was really cool to learn about it while having had it. So that was just kind of a unique perspective for me.
All right, thank you, Whitney. Casey, you were group 2. Jalen was here, but then she left before I could pick on her. So I'm going to have to pick on you.
Yeah, absolutely. And I'm so sorry, guys, because this is going to be the only question I can answer. I have a patient at 2. But as far as wanting to sign up for this rotation, I thought it would be super interesting because we're all kind of in the dark when it comes to COVID, and we're all as a collective kind of learning things as they come out and as they go. So something that could be hypothesized or changed is kind of interesting, having a design for COVID. We're all just kind of testing the waters and seeing how, what helps, what's the best method for testing, what's the best method for the vaccine rollout. And so it was really interesting to kind of be a part of that firsthand on the university level, to see how they kind of handle, students coming back to school, as well as faculty, athletics. It was really a cool aspect to kind of be a part of, as well as I was interested in having Dr. Klepser because he was a great mentor as well. And to kind of confirm my signing up for the rotation, one of my preceptors as well kind of messaged me saying he would recommend me. And so it kind of solidified like, okay, maybe this is something that I should do. So it was a really enjoyable experience overall.
And Casey, since you do have to leave to go see patients, is there anything else that you just want to add about, the rotation, anything you took away, something unexpected, this is your
Yeah,
moment.
so I would say overall, if we're able to continue this rotation or something similar to it, it'd be really beneficial for students. It was really a unique process because you kind of got to be a part of a variety of things. We were able to potentially publish a paper, test students, do vaccination clinics, kind of do presentations for people as a whole. And so you really got a whole variety of experiences on this rotation instead of just one aspect, which was really neat.
All right. Well, thanks, Casey. Go ahead
Yeah.
and take good
Thanks,
care of the
guys.
patients.
Have a
Bye.
great day.
All right. Now I'm going to go into the newbies. Taylor, well, let's start with Indira, because Indira is kind of, I apologize, Indira, but I'm going to call you an odd duck on this because your participation in this rotation has been a little unusual, hasn't it?
Yes. Hi, everyone. My name is Indira, and my last name is pronounced Tabovia. Not as bad as it seems on paper. But she's right. My experience with this was a little unique. So like Whitney, I also had COVID back in January, and I was fortunate enough to be able to join this elective a little bit early while I was in isolation. So I had COVID just as the rotation was starting. I had already done a few days and then was able to switch into this for 10 days, get kind of a trial run, and now I'm back for the next 6 weeks. As for why I was interested in it, similar to what everyone else has said, it seems like a very unique opportunity, something that doesn't come around quite often and something that I wanted to take advantage of. I felt it was a really good chance to stay on top of the ball with everything that's coming out and be ahead of news and different updates coming about, just something that I didn't want to let pass by.
All right, thank you. And last but not least, Taylor.
Yeah, so for me, I initially was in a different rotation, but due to some staffing changes, I had to choose a new rotation. And it was kind of in the same time where I had already kind of planned on considering it and possibly changed it anyway. But like Dan and a lot of others said, that you don't really necessarily live through a pandemic all the time, at least hopefully not. So I want to take an opportunity to take advantage of that, as well as I wanted to be able to expand my clinical skills. So I haven't really done a lot of point of care testing. So that's something that I was interested in, and being able to say that I know how these tests work and how they're ran.
All right, perfect. And then, moving on. And again, please, if there's other questions, please just unmute yourself and go ahead and jump in. Otherwise, I'll, keep asking them some questions. The next thing that I, just to highlight just how fluid this rotation was, just talk to us a little bit about what your expectations were going into this rotation. And did you necessarily do the things you thought you were going to do on the rotation, or how did things change? Or what did you actually experience? And I'll start with Whitney on this one.
So expectations going in, you guys are probably gonna laugh at me for saying this so many times, but I am your typical type A pharmacy student who likes having things planned out and having a nice structured schedule. But our very first day on this rotation, Dr. Klepser said to us, you're probably wondering what your schedule looks like, what you'll be doing. We have no clue what you're going to be doing. So I didn't really know what to expect, other than we had 4 tasks that were kind of assigned to the 4 of us throughout the week. So it was essentially set up so that Monday through Thursday, we would each have a different role. And then one day was set aside to run these testing clinics. But I think really by the second and third week, those 4 roles were just kind of background noise. We didn't really do them so much. We just had more things coming up that seemed a little more important, like actually planning and running the testing clinics. And we did it multiple days a week. So yeah, my expectations, I didn't really have much to go off of, but I feel like we just did so many cool things kind of echoing off of what Dean Durst was saying about the interprofessional collaboration, we got to meet and like talk to so many different people from Ferris. We got to talk to different MPA people, public health officials, and it was just a really unique experience to meet these people. Like I wouldn't have ever came across them in any normal rotation. And it was just really different than what I expected, but I feel like we all got a lot out of it and it was really beneficial. So hopefully we don't have another pandemic, but I feel like we would all be very prepared if we did.
Dan, how about you?
Similar, well, not similar to Whitney, but I'm the opposite of Whitney for myself. I'm not the
Oh,
typical.
wait a minute.
Like,
How did you almost start out by saying the same as Whitney, but then you decide no, opposite?
well, I didn't have expectation, like any type of expectations coming to this rotation, but for myself, I'm not type A. Like I thrive in like just any situation that's not like planned or scheduled. So this rotation really, I guess, welcomed me because we did do things that we weren't, expecting to do. We had last minute like calls. We interacted with so many different types of health professionals, different types of professionals in different types of colleges. And for me, that was something I honestly didn't expect we would be doing, but it definitely helped me grow as a health professional. And I felt like we did a lot, and like it just, for me, that was like a thriving environment for myself.
All right, excellent. Thank you, Dan. Now, Taylor and Indira, you guys, maybe can't give a lot of perspective since what is today, Thursday. All you guys have been doing is pretty much just running around like chickens with your heads cut off all week. So maybe you haven't had a chance to think about things. But why don't you just talk about, a little bit of what you expected, and then just, was there an easy transition for you guys going into this rotation? Did we hold your hand a lot and stuff like that? Taylor, why don't you go first since I can see you laughing?
Yeah. I would say no. We were just kind of, because it's just, you get kind of thrown in what's already going on and you kind of just have to catch up as you go, which is true in real life. They're not necessarily going to have somebody be there all the time. You just kind of have to learn as you go. So our first day we had multiple Zoom calls, and then we were supposed to be in Grand Rapids to go meet at Grand Rapids Community College because they wanted to do their testing clinic. And then we found out that we'd be back 2 days later to actually start testing people. So I wasn't really expecting it to be that quick. And then today and Tuesday, we did testing clinic all day in Big Rapids. So we're just kind of bouncing around between Big Rapids and Grand Rapids, coordinating testing efforts. The one thing I wasn't expecting with this rotation is the making manuscripts and publishing. I really wasn't expecting that on this rotation. I thought it was going to be more like clinical work. So when Dr. Klepser mentioned it on Monday, I was kind of surprised, but I'm excited.
All right. Indira.
Sure. I also didn't have very many expectations going in. I was most excited to see how it was going to be run. I've got younger siblings, so we constantly at my house talk about, well, what's going on with the different school districts. And my parents often look to, well, what is the university doing? So I was interested to see it on a higher level and not just be the person receiving the news, but I thought maybe perhaps being someone that was involved in those conversations and hearing Dan and Whitney and Brandon and David, who aren't here today, but hearing them at other talks or at Q&A sessions kind of excited me for that. Being on that kind of 10-day trial, as I like to call it, showed me that more of the background work, like Taylor said, was getting stuff published and a lot of the research that goes into it. So I'm excited to get more of that as an experience.
One thing that hopefully the students will echo is on this rotation, everybody's, pretenses, just they're stripped away. You get onto a call and we got the dean, we got a vice president, we got whoever else, and people, it's just like, you know what, drop the doctor, just call me Mike. All right, we're dealing with stuff. I'm tired. It's late. We're just dealing with, yes, I know we're having a call at 9 o'clock at night. So thank you guys for being flexible. But I think that they saw the reality, and really how valuable, how much we leaned on the students. I mean, I'm not asking them questions, that I already know the answer to. just to try to test their knowledge. We're asking them, important questions that nobody knows the answer to at the university. And we're likely to ask Jim Bachmeyer to write a check for $100,000 based off their response. So, I think that, to me was, a nice environment to teach, that you can, be a little bit more real in the experience. And for me, that's been one of the great things. And, with these students, I've got to know them, well as people as well as, students. And so, yes, I will pick on, Whitney and Indira for bringing COVID to my rotation. I'll pick on Dan for having a Zoom call, right in front of his unmade bed, because I've been working him so hard he could barely get a little bit of sleep and stuff like that. And I hope that, sometimes and Steve can attest to this, I don't have much empathy. I'm not good at fake sincerity, but it gives me an opportunity to be real with the students and interact with them in a meaningful way for me. So hopefully, you guys felt that as well. Now for Indira and Taylor, no, we don't do that anymore. That's the way it used to be done on the rotations. So we're back to getting all worky and serious and stuff like that.
Mike, I have
what
a
about-
question.
Yeah.
This is Renee. So are the students involved with these rotation students involved in helping with planning like the vaccine rollout process at Ferris?
I'm going to let Steve talk about what he's been thinking and how he's, brought that in a little bit to this rotation so far.
Yeah, that's a very important aspect of all of this. And, we've tried to confine a lot of our discussion to the testing aspect of COVID, but we know that's transitioning, not that it's leaving, but there's also a lot of attention now to vaccinations and how those will be administered. I think we've done a very good job of making students aware of the volunteer opportunities for that through both District Health Department 10 and Mecosta County and Kent County Health Department for the students in Grand Rapids. The value there is that, our students and the students on this call know that they are certified to administer immunizations. What the health department sees there is, added capacity with every student. At this point, we really haven't seen a significant need for vaccinators because the supply has been quite limited. But it's fully anticipated that as the supply increases and we see, 3 or more vaccines available, that then students will be brought in to those clinics to actually administer vaccines. And what's being done then is District Health Department 10 has a list of volunteers. They get the students' names. We verify that they are pharmacy students. And again, I know there are a lot of nursing students signing up as well. We verify that they're nursing or pharmacy students and that they're certified to immunize. So that gives them this pool of volunteers. We're also encouraging students to volunteer for any other role, because if you've been at any of those vaccine clinics, there are many functions that have to occur in a very timely way for that to keep moving on. In fact, tonight at 5 o'clock, we'll be meeting with District Health Department 10 to plan out a March 13th vaccine clinic here at Wink Arena. They expect 600 vaccines to be administered. I don't know if any of our students have been signed up yet or have been contacted, that they will be needed, but that's where they're fitting in right now. I think the other part of your question, sorry to go on so long, it's when will the university be administering vaccines? And we are approved as a vaccine site, as a vaccine provider, but of course, no supplies, no allocation yet at all. That's still limited to the health departments, the health systems. I think a few pharmacies now are getting vaccines, but it's also limited, to the early phases as well. So Thanks for the great question, Renee. Kind of a long answer, but I think you can see that just as we relied on students for the testing and continue to, we will be doing the same with the vaccine rollout.
And one of the things that I know that Jalen and Casey did in group 2, they were on rotation as the vaccines started to become available. And, you know, they, as well as even now Indira and Taylor, you know, are fielding so many questions about the vaccines, you know, in terms of vaccine coverage against variants, duration of immunity, you know, interactions with various disease states. So they've been right on top of all the literature, as maybe Taylor and Indira can attest to my flurry of text messages last night, somewhere around 9 o'clock last night as I was reading New England Journal of Medicine. We stay right on top of that and share that information. Also, I know that Casey and Jalen, I know that some pharmacy owners, you know, have reached out to, you know, us and me about, you know, immunization clinics if they get things available. And I know that Jalen and Casey, you know, helped the Van Buren Health Department in an immunization clinic. And we were brought in from one of the our alumni at Pawpaw Pharmacy. So our students are helping out, you know, in situations like that then as well. Any other questions from the group?
Yeah, let me just add to that. I see other faculty members here, and I'd certainly want to acknowledge the College of Health Professions too, because their students have been volunteering significantly, and they did during the testing and continue to. Clinical lab sciences, that group have been present in the testing clinics. So the other part of this, as was mentioned, you know, the interprofessional piece has really been very evident through every stage of the clerkship development.
No, definitely. And, you know, I think that's been great, you know, in terms of meeting with, you know, clinical lab sciences people. You know, Dan has been great, you know, in terms of not only, you know, volunteering himself, but working with the students, you know, for evaluating these test performances, you know, as well as Dr. Jadov as well has been, you know, great, you know, in terms of talking with some of these sensitivity, specificity, and prevalence and testing strategies as well. It's been a great opportunity, you know, from that perspective. Felix, were you going to have a question? I'm going to just say, Felix, I'm impressed. You're wearing a tie. You're making, you know, me look really bad here.
Yeah, for the first time in my life, I'm wearing tie.
Oh, it's so great to see you.
I just wanted to say good job. I mean, I was very impressed with how the students were happy with working on this project, and I think it's a good thing. So good job. Keep up the good job. Yeah, that's what I would say.
You know, I know we're getting close to wrapping things up. And I want to give everybody just a final opportunity to give, you know, closing thoughts and comments. You know, even the dean. I'll even let him talk again. But I'm going to make it go last.
No, I wanted to ask one more question, a real quick question.
All right, go ahead and answer your question.
It's just a yes or no, but you don't have to answer it that way. Public health, you've had this immersion in a clerkship that is really grounded in public health. Should it be emphasized in the curriculum more than it is?
Oh, so now you're like just like feeding it up to Dan. Dan, hey, are you getting a dual degree in anything?
Yeah, I'm getting, I forgot to mention that I'm getting my master's in public health as well.
So do you want to see more public health in the College of Pharmacy?
Yes, I 100% agree with you on that one. 100%.
Whitney, how about you? Do you feel like in all disclosure, I do offer an introduction to public health elective in the College of Pharmacy. So not everybody in the College of Pharmacy gets exposed to that elective. And so I'll ask, you know, from the perspective of the typical student going through the College of Pharmacy, do you think that you have a good enough appreciation for public health and what they're doing and what they're trying to accomplish? And I think that's what, you know, the dean's getting at. You know, do we prepare you well for this type of role?
Yeah, so I obviously took your point of care testing elective, not public health. So I don't think I really understood like how much involvement we could have with them until this COVID rotation. So I think it's something that could get incorporated a little more because I mean, we were so involved with public health, but I wouldn't have had that opportunity without this COVID rotation, I don't think.
Taylor, how about you?
Well, I didn't take point of care elective or public health elective, and I'm not getting a master's in public health. So I have like no experience in any of this. So it's nice to be able to like do it more because especially like with the point of care testing side, we had like one lab and it was like about a couple hours where you got to like play around with the test. That was really about it. And then the same thing, I really don't think I was prepared or understood what goes into public health, what everyone does, what their role is. I think I was just ignorant, honestly. So I think it'd be a great addition to the curriculum.
And Taylor, I'm going to do a self-serving plug right now to the dean. You know, like we train our students for the immunization program and we have the full training with that, I would really like to see a more in-depth, you know, offering, whether it's a certificate program or something else for point of care testing. Because I think really the pandemic just showed how pharmacists can play a huge role in this. And I think that we really need to, you know, highlight that more in our curriculum. Off my soapbox.
agree, Mike.
Thank you, Taylor. What's that, Renee?
I agree with you.
Oh, if I was a warm and fuzzy guy, I'd be giving hugs right now. But everybody knows as fuzzy as I get is my beard. Indira, how about you?
Sure. So similar to Taylor, I also did not take either elective, nor am I pursuing a bachelor's in public health. I agree, though. I understand how difficult it might be to incorporate. There's so many things that could go into the curriculum, but I think that there's a lot of value that's in this. And like you guys have said before me, the importance of pharmacists and the role that we have in this has really had a lot of light shed on it through the pandemic. So I agree with all of you.
All right. Dean Durst, do you want to answer your own question?
Well, yeah, I guess that was a leading question. It wasn't meant to be that thinly veiled, but it certainly it came out that way. Yeah, you know my thoughts on this, and I think whether it's point of care testing or public health, you know, our neighbors, the College of Health Profession, has a public health program, obviously, and a clinical lab sciences program. So it seems like a great opportunity for interprofessional, cross-college curriculum development. So I'm completely supportive of it.
And from my perspective, you know, I really didn't get to know many of our neighbors, you know, before this either. You know, I'm based out of Kalamazoo, so I'm, you know, up in Big Rapids only for short periods of time. But I've made some great connections over in the College of Health Professions, you know, from Dean Gibbs all the way down to, you know, numerous faculty members. And I know that Emmanuel and Dan, we've collaborated now on manuscripts. We've collaborated on a grant submission. And I think there's still a lot of opportunities there. You know, with my public health elective, now I'm a pharmacist for heaven's sake. The only reason I, you know, offering a public health elective is because I kind of backed my way into a lot of contacts with public health officials, you know, at the state and the federal level. Not even having any contacts, you know, over at the College of Health Professions in the program. And, you know, I've gotten Dean Gibbs to commit as well as Emmanuel to help us with a little bit of a review, content review on the elective for public health to help us make sure we're offering good, you know, a sound foundation, you know, in that. So even for me, from a professional standpoint at the university, somebody who's been there at the university, you know, this is 20 years I've been at Ferris and still getting an opportunity to meet new people and make more, you know, relationships.
So that's a perfect segment because we're now at about that 10-minute mark of the transition where we should start allowing people to migrate to other sessions. We should say thank you. Definitely little hand applause, golf clap. And wonderful presentation. I kind of learned a lot. Even just kind of sitting in the background listening and wonderful. Thank you very much. Thanks to your students.
Thank you guys, and thank you for attending.
Thank you,
and
everyone.
I'd like to thank the P4s for coming back again. I know a lot of you guys are off doing other things. It's great to see you guys again. And it's great to touch base with you last night. So everybody take care.
Bye, everyone.